Stop doing abdominal crunches if you have pelvic floor dysfunction. So stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County, telling you to please, please, please stop doing abdominal crunches. They're not as good as people think. You don't isolate your abdominals and try to work them out. The issue we're having when it comes to all movement exercises, specifically pelvic floor dysfunction, has to do with the fact that our muscles don't necessarily play well together. So why are we isolating an area and working the heck out of it when the issue is, as strong as your abdominals may be, they have no idea how to play with the obliques, with the lower back, what their role is in holding your posture, what their role is with the lower extremity movements. All of these play a direct role on the stability of your pelvis. So instead of isolating a muscle or an area and working it out, work out in a fashion where the whole body is involved and you're holding a pose, and you're holding a pose correctly. Duplication of an exercise or a pose does not get you anywhere. You got to understand the basic principles that are required in every pose. And nothing makes sense except for the fact that we all have done the same exercises that are required to strengthen our body as adults. And those are the exercises we all did as babies. And the reason those are authentic and innate to us is because as babies, we did them without being coached. And all babies on this planet do those exercises the same way. So we must be programmed to be doing it that way. I want this video to be that opportunity for you to think, that makes sense, or she's full of it, it doesn't make sense. But think about what I just said, and if you have any questions, use one of the methods of contact in the description box to contact my office. I'll be more than happy to talk to you about it. Thanks for watching.